evening, everyone. Just waiting for the confirmation and then we'll start. Let's okay, so we have the just yes. Okay, so we have a good to go ahead from the back end. Okay, so good evening, everyone. Myself, Dr. Rijul Agarwal. Okay. Yes. Myself, Dr. Rijul Agarwal. I'm the orthodontic faculty at AIIMS. We are back with the masterclass session, our 1 hour masterclass on INICET PYQ. Okay, and just my face is cutting, they're saying. Just a minute. Now I think it must be fine. Just a minute. I think now the face is fine and we'll start the class. Okay, enough waste. So myself, Dr. Rijul Agarwal. Today your INICET forms are also released. Your basic registration and all else also started for the November exam. The date is also out for the same. Hope you all have seen the notification. Okay. So today I am discussing the orthodontics questions of May 2024 exam. See the students, the pattern which we have noticed is that the May exams generally have more questions on orthodontics as compared to the November exam. Okay, so past 22, 23, 24, 25 till May I have seen this kind of pattern. Approximately 20 to 21 questions come from one subject of orthodontics itself. Okay, so I hope those who are in November exam the pattern is not followed and we have less of questions of orthodontics and the distribution is equally spread across. other subjects as well. Nevertheless, we are here to discuss the questions. So beginning with the first question. Bilateral cleft lip occurs due to failure of fusion of. The options are lateral nasal and medial nasal, lateral nasal and frontonasal and the median nasal, and the maxillary and the mandibular process. I think at the time when this question came, NEET also had the same question in the exam March 2024. Okay, so one question from cleft you can expect in November as well. Okay, good evening to you as well. So someone says A, C. Okay, so the correct answer is option C. What happened? Sorry for the interruption. So the correct answer is option C. So if we look at the options, option D is directly eliminated. Okay, maxillary and mandibular process never fuse. Okay, lateral nasal and the frontonasal. So first the fusion, if you look at this diagram, the maxillary process, there is fusion from the lateral and the medial process, which fuses with the frontonasal process to form the upper lip in turn. Okay, now bilateral cleft lip and cleft lip, okay, occurs due to the failure of fusion of the frontonasal and the medial nasal process, and not lateral and medial nasal process. And if question comes on cleft palate, it is due to the failure of fusion of palatine process. Important points to remember is the timings of fusion, because that will tell you the teratogens, if taken during at this time, can lead to the following problems. Okay, so timing of fusion is important for you to remember. Moving ahead, so the correct is option C. Next question, quite an easy question. Up to what age thumb sucking is considered to be physiologically normal? 1 year, 2 year, 4 year, or 5 years? Quite an easy question, so I don't think I need to waste more time on this. Yes, C, up to 4 years is considered normal. Okay, so this is the flow chart. So up to less than 2 years, bottle feeding plus thumb sucking is normal. 2 to 4 years, continued thumb sucking, and up beyond 4 years, it is considered abnormal. This is the flow chart depicting the pathophysiology of thumb sucking, leading to lowered and backward tongue posture, buccinator activity, constricted maxilla, crossbite, and lower, leading to class 2 division 1 kind of malocclusion. And it can also lead to anterior open bite. Okay. Next question. Now this question, different books, different students gave us various options, so I took all of them and combined them into this question. Okay, your exam will have only 4 option or multiple answer type question, option correct type question, so not to worry. Okay, but here we are not conducting an exam, we are here to discuss, so that's why I have taken it all the options for your consideration. At what age mesodense should be extracted? Option A, immediately as it is discovered. B, only after 12 years of age during initiation of fixed orthodontic therapy. After complete root formation of permanent incisors. After half to two-thirds of root completion of incisors. Upon formation of one-third of the root following the eruption of permanent canines. Upon formation of two-thirds of the root. So yes, option A, immediately as it is discovered on radiographs. Some textbooks, somewhere it is written that it should be extracted upon one-third of completion of the root. I don't know why. Mesodense, if present, will lead to diastema formation. As soon as possible, when it is discovered on accidental radiographic findings or whatever is the case, it should be extracted. Okay, it is different from neonatal tooth. Okay, that it can be incisor as well and all that you know from your periodontics classes. Okay, here mesodense should be extracted as it is discovered, whenever it is discovered on radiogram. You don't have to wait for the root formation, one-third root formation, two-third and all that. Okay, it should be extracted as soon as it is discovered on radiographs, whatever is the situation of that team. So option A. Next question. In CVMI, accelerated or peak mandibular growth corresponds to which of these stages? 1 and 2, 2 and 3, 3 and 4, 4 and 5. Very important. Skeletal maturity indicators in recent exams of INI, they have become quite popular. Minimum 2 to 3 questions are coming from this. Skeletal maturity indicators. So CVMI में you need to know about the images of each stage. You need to know about the shape, through how to distinguish between various CVMI stages. Hand wrist radiograph. So you can get a image based question out of it, which you already got if you have undergone the 2025 paper. Hand wrist radiographs you should be aware. Okay, and other skeletal maturity indicators as well. Okay, so yes, option C is the correct answer. Okay, so 3, in which lower borders of C2 and C3 are concave and C3 C4 are trapezoid or rectangular horizontal in shape, with peak in mandibular growth will occur within 1 year of this stage. 4, bodies of C3 and 4 are rectangular horizontal in shape, with C2, C3 and C4 being concave. Okay, so 3 and 4 both. और अगर ऑप्शन में, let's modify this question in 2025 November में you get option instead of 1 and 2, 2 and 3 you get 1, 2, 3, 4. See by 1, 2, 3, 4 which will you take out of 3 and 4? 1 and 2 are directly eliminated, 5 and 6 are also eliminated. 3 and 4 में से most appropriate answer कौन सा हो? If anyone can tell. Yes, 4 more than 3. Peak mandibular growth is 4. Means if the patient is in CMI stage 4, he or she is in peak mandibular growth. If the patient is in CMI stage 3, he is approaching the peak mandibular growth, so you can start with functional appliance therapy. 4 पे if you give, there won't be anything which you can do. So 4 पे अगर patient है तो you can go for fixed functional appliance, and in 3 you can go for removable fixed functional appliance therapy. Okay, what is the indication of lingual arch appliance? Easy question again. Five A. So yes, very easy question. Now lingual arch is given in the lower arch, so option B, C, D, or all limited, that leaves you with option A only. Nothing much to explain in this, so we'll move towards the next question. Which of the following appliance is not used in the treatment of buccal crossbite in maxilla? Hyrax, quad helix, Jones stick, pendulum with Hyrax. Option C. Anyone else? So no one. So yes, option C is the correct answer. So buccal crossbite in maxilla means we need an expansion appliance. Okay, Hyrax is expansion appliance, quad helix is expansion appliance, Jones stick is a distalization appliance, and pendulum with Hyrax. Now pendulum is also a distalization appliance, but they are given with Hyrax. That leaves you with option C, Jones J. Images of all these appliances, pendulum, modification of pendulums, should be known to you. Expansion and distalization appliances, images should be known to you. Next, another question, similar kind of question which we discussed. What is the typical facial appearance of the patient who engages in thumb sucking? Long and concave, short and convex, long and convex, short and concave. So we discussed the pathophysiology of thumb sucking in the previous question, I think second or third question. There only I mentioned. Okay, so how will the class 2 div 1 patient appear? Simple as that. So a very easy question. Okay, if I go back to the previous, this was the second question. Pathophysiology of thumb sucking. Persistent thumb sucking, what it will do? Exaggerated buccal crossbite and lowered and backward mandibular posture. So the mandible will rotate downward and backward, leading to long and convex profile like this. So hence C is the correct answer. Okay. Skeletal maturity index is not measured by which of the following? As I've told you, skeletal maturity indicators in the recent exams have become quite popular. There was a time when classification systems was popular. Now they have moved from classification of malocclusion to this. So I think the era has changed. So C is the correct answer, that is adhesion of tooth. Okay, so dental calcification is by known as Demirjan method, who measures the calcification of third molar to assess the skeletal maturity. Again I am repeating, images of CVMI, hand wrist radiograph and other atlas method and all that. Okay, they are all important. Okay, there is a new kind of branch which is coming, dental forensic odontology. Okay, so based on that their examiners are asking question based on because of this. Okay, so moving ahead is next question. Mesial step in deciduous dentition represents. Distal terminal of maxillary, second molar and mandible second molar coincide. Distal is mesial, a very easy question. Distal slope of maxillary canine coincide. Distal terminal of maxillary second molar distal to a second terminal of mandibular second molar. So what is this name of this classification? Mesial step, distal step. So this is known as Baum's classification, BAUME. Okay, so yes, D is the correct answer. C is eliminated, it does not provide you about the canine relation. Okay, so this is the classification. Now they have asked you directly about the mesial step. Other type of question which is asked, what it can convert to this. We have discussed this ample number of times, what it can convert to, and it can, due to forward growth, what it can lead to, can also get into. Next question. Inclined plane appliance is used for the correction of. anterior posterior cross bite, open bite or deep bite. Now the question, when this question came, it was not mentioned that the inclined plane appliance is given for the upper arch or lower arch. Sir, when will you take questions or lectures on aligners? Now I have been allotted, we have been instructed to take previous year questions of INICET. We reached May 2024, then November, then May 2025. Post that, we'll see what's the time available. Otherwise, you can very well contact the admin at DAMS and they can help you out in my lectures, which are already available on the eMedicoz app as well, both aligners and on-aligners as well. I'll try based on the time, because I have to give time to other faculties. I cannot take complete sessions on YouTube myself. So you have to contact them and maybe they can help you out, or they can provide me some time for the same. Okay. So yes, correct option is anterior cross bite. Okay. Now this is the inclined plane appliance known as Catlin's appliance. Okay, also known as lower anterior inclined plane. Now if the question comes about upper anterior inclined plane, it is used for correction of retruded or retroclined lower incisors, or it acts as a retention appliance post twin block therapy. Or upper anterior, if inclined is removed, upper anterior bite plane is used for correction of deep bite. Posterior bite plane is also used for correction of anterior cross bite. Posterior bite plane is also used for correction of anterior cross bite. And also for correction of open bite, posterior bite plane. But if both of them comes, then anterior cross bite over open bite. I hope I'm clear with all of the uses of the bite plane: anterior, posterior, upper anterior, upper anterior inclined, lower inclined, and all that. Coming back to lower anterior inclined plane, it is cemented on the lower arch for correction of upper anteriors and a single tooth cross bite that is of recent origin. Okay, it is constructed an angle of 45 degree to the maxillary occlusal plane, and it should not be used for more than 3 weeks. Why? Because it will lead to extrusion of posterior teeth. Okay, another very important, and this is the image of Catlin's appliance. So uses of bite planes, functions, everything should be thorough, because it's a very popular question. I think every NEET INI exam had a question of anterior inclined bite plane, Catlin's appliance or bite plane related question. Next, so a multiple option correct type question. Which of the following statements about quad helix appliance is true? Use wire made of 0.038 inch alveoli 0.038 inch SS, force applied is 100 to 200 or force applied is 200 to 600. This question was also part of our question bank of dams. Okay, this question, same kind question. So when it came, I think you would have been able to answer it, those who appeared for that exam. Anyhow, so although a single option is correct, but multiple statements correct type of question, this is the new kind of pattern of your INI exam. True and false, match the following. So Nimisha says option 4. So let's get to the question. Correct statement. Wire made up of 0.038 inch alveoli? No. SS correct. Force applied is 100 to 200 grams? No, very less. 200 to 600? Yes. So option B and D are correct. So yes, fourth is the correct answer. Again, I'm saying expansion appliances, images, and these all are important. How to go about these type of question? You have to read each and every statement and then mark the correct answer. If you don't know, click on next and move to the next question. Do not waste your time in. And next, as I've told you repeatedly, in INI exam, if you are able to narrow down your question or option to 2 correct, 2 you are able to eliminate 2 incorrect, then do attempt that question. Do not leave that question. So this is the image of quad helix, how it was evolved from how it's activated and all that, which arm to open, which from where expansion is desired, we have discussed from WRC now. Next question. Which of the following does not compensate for incisal liability? Increase intercanine space, increase intermolar space, labial eruption of incisors, interdental spacing. B. A very easy question and a direct question. I think the quad helix one was a little tricky if you know about it, but this is a very direct question. Okay, so from development of occlusion, this topic, importance are the measurements which are there, the value based question. Okay, so this is how the incisal liability is compensated by interdental spacing, labial eruption of incisors, and intercanine width increase, and not intermolar width. It is 7.6 mm in the upper, 6 mm in the lower, and this is how it is compensated. Remember about the leeway space and all that. Next question. Pre-surgical nasoalveolar molding is done to. passively keep the nasal fragments and lip segments in contact, lengthen the columella passively, pre-surgical manage deficiencies for enhanced function, bring lip segments into contact. Now this type question, when it came, it was a very interesting question. Even I had to think about it before providing you the correct answer. Okay, you say option B. Okay, so looking at the question, when it first came, technically all options A, B, C, and D are the objectives of pre-surgical nasoalveolar molding. Okay, to keep the lip segments and passively in contact so that the surgical sutures are not tensed, lengthen the columella passively, that's also correct, pre-surgically manage the deficiencies for enhanced function, also correct, and bring the lip segments into contact. But more appropriate option out of this will be B, because in exam you have to mark the most appropriate answer. Okay, so it has this kind of this device which goes into the mouth nose so as to lift them and lengthen it passively. Okay, so I don't know with what aim the examiner provided this type of options, because they are very close to each other, but most appropriate out of this will be lengthen the columella passively. Why I arrived at the B option? Because A, C, and D are objectives of lip taping as well. So these things can be managed by lip taping, except this. For this you need to go for PNAM appliance. Okay, so image of the PNAM appliance, it's made of acrylic, how and all that for impressions are taken, we have discussed. Next question, what is the appliance shown in the image? Now there are two images which came up. Some said image A came, some said image B came. The options and the answer will change. Okay, so as I have told you, we are here for you guys to know something and get, it's not an exam, we are here for the discussion. So that's why I picked up both of these images in my discussion so as to help you out. Hybrid pendulum, hybrid T-Rex, frog appliance, first class appliance, or hybrid Hyrax. So hybrid T-Rex, Nimisha says option B. Now I'm asking about option, you just tell me about image 1 and image 2. Image 1, which option is correct? Image 2, which option is correct? Because if both of them will have different kind of answer correct. Yes, image 1 B, image 2 C. C. Now if we look at when this question came, the lot many students said कि sir ये appliance तो हमने देखा ही नहीं, what all came and all that. Okay, simple way to answer this question would have been, okay, if I have told in the class directly itself, if there are implants and tads which are present in the palate, then an appliance becomes a hybrid appliance. Next, looking at the images, all of them have a kind of a screw which is present in the midline palate region. One has a screw which is like oriented like this transversely, and in this image it is oriented antero-posterior. So अगर antero-posterior screw होगा, if you turn it, it will take the thing backward, so it will become a distalizing appliance. If the screw is oriented transversely, it will become an expansion appliance. Let us assume option image 1 came in your exam. Okay, so an expansion appliance image came. Pendulum is a distalizing appliance, eliminated. T-Rex, both expansion and okay, understood. Frog appliance is a distalizing appliance, eliminated. First class is a distalizing appliance, eliminated. Hybrid Hyrax is an expansion appliance. That left you with B and E option. And Hyrax you have seen directly, you would have been able to opt that option. So एग्जाम में हमेशा वही नहीं आएगा जो आपने देखा है. You will get some images, some questions which you won't have seen. Then you have to go with the rule of elimination and with a calm mind कि what they have asked. Because the examiner जो बैठा है उसको एक ना एक दो tricky question डालने ही पड़ेंगे, otherwise the result will be 100% for everyone. Coming to option 2, it's a distalizing appliance. So option A, C and D remains. Pendulum, you have seen the image. Hybrid होगा भी तो उसका image कैसा होगा. And most importantly, if you look at the arms, it's like the legs of a frog. So directly you would have been able to mark it as frog appliance. Okay. क्लास में पेंडुलम देखा है आपने, टी-रेक्स देखा है, फर्स्ट क्लास देखा है, हायरेक्स देखा है, फ्रॉग ही नहीं देखा था. At that time I haven't shown the image, I haven't discussed this image. So this is the image of a T-Rex appliance, simple T-Rex. अगर इसी में यहाँ टैग डाल के ऐसा कुछ कर दिया जाए, ये हाइब्रिड T-Rex बन जाएगा like this. So it's both a distalizing and an expansion appliance. So that's the way to go about and answer a question. Okay, I hope I am clear. Next question. Peak height velocity and peak weight may be useful to ascertain the growth of an individual. Which of these is true about the relationship of peak velocity in height and weight? Peak height lags behind weight by 6 to 12 months. Peak weight lags behind peak height by 6 to 12 months. Peak velocity lags behind peak velocity by about 3 months. Peak weight lags behind peak velocity in height about 3 months. So basically you have to differentiate which is ahead, which is behind, and by how many months. Simple as that. So if you know, if you have know, then attempt it. Otherwise you can very well skip this type of question, because here rule of elimination also won't work. So that's the way to go about it. Option B. So yes, option B is the correct answer. So technically it is by 12 to 14 months approximately. So peak height velocity comes first, then there is a delay, then the weight starts to increase at the time of pubertal growth spurt. But the correct or the nearest option would out of this is 6 to 12 months as provided in the exam. Okay. So stimulates with the HPG axis related to the pubertal growth spurt, Remember the Scammons growth curve. ये जो छोटे छोटे points I am mentioning, this is for you guys to quickly go through them. Okay, a concept related to it, if you know very well. If you don't remember, post the end of this class you can go through the notes and revise them quickly, because less than a month is remaining now for your exam, 9th of November. Next question. Class 2 div 2 feature is a very easy question. Increase overjet, increase lower facial height, decrease gonial angle, decrease interincisal angle. Division 2 upper incisors are retroclined. I don't think I have to wait for the answer to this question, and nevertheless, sixteenth D. So the correct answer is option 3. Division 2, the upper incisors are retroclined or upright like this. So overjet will be decreased, the lower facial height is decreased, there is decreased Gorian angle or horizontal growth pattern, or another feature is square shaped upper arch, and the interincisal angle, because of the uprighting of the incisor, the interincisal angle increases, not decreases. If the incisors are upright like this, the interincisal angle increases. If they are proclined, the interincisal angle decreases. It works inversely. Okay, so division 1 का feature, camouflage के feature, camouflage extraction pattern and all that. Class 3 का feature, all should be known to you. Okay, most important is true and pseudo class 3. Column angle. I'm just writing these terms. जिनको नहीं, if you are not able to recollect, post this session 9 to 10 PM, go through these things. They will again come back in your mind. Facial angle represents the relationship between maxilla and the mandible, cranium and the maxilla, cranium and the mandible, upper face and the maxilla. A cephalometric question. If you remember the landmarks, the angle is plotted between which points? You can answer this question. So facial angle is part of Downs analysis. It is the angle between FH plane and the facial plane. Now facial plane is drawn from nasion to pogonian. Pogonian is a point which is on the mandible, so it is related to cranium and the mandible. MCQ solving trick बता दीजिए first. I'm not getting your point. I think each and every MCQ I'm trying to help you out with the same trick only. Okay, so it is the relationship between the cranium and the mandible. Next, what is the major distinction between self-etch and conventional bonding system in orthodontics? Self-etch combines etching and adhesive in a single step, minimizing the risk of over-etching and protecting enamel integrity. Conventional achieves higher bonding strength, fast section A and B, how to cope up correctly. So for that, first of all, there is no way to solve fast MCQs. First you have to read the question. If you know the concept, then the MCQ solving is fast. If you don't know it, then the MCQ solving becomes difficult. Like in the previous question, if you know about the facial angle from where it is drawn, then it becomes fast. You don't have to look, you directly know that it's a relationship between FH plane and the facial plane. Facial plane has points nasion. Nasion is on the cranium, pogonian is on the mandible. Simple, cranium and mandible. So then it becomes fast. Okay, so concept पता होना चाहिए. And now there are certain questions जो question bouncer होते हैं बिल्कुल, जो कभी सुने ही नहीं होंगे, या it will be like something new for you. So remember that if it's new for you, it's new for everyone appearing all over India. It's not like for you they have question papers come same for everyone. It's just based on permutation combination, the order is changed. So if you don't know, just skip and move ahead. And third, if you are able to narrow down your options to 2, then do attempt that question. Now किसके लक में ये है कि ऑर्डर में वो खरा डिफिकल्ट क्वेश्चंस पहले आ गए, किसके बाद में है, किसके बीच में है, दैट इज इन नो वंस हैंड. So you have to answer every question, read every question with a calm mind. Coming to this question, if you look at the options and all, they are too big. I think approximately 1 minute will be taken for you to read the question and all options. But if you read them with a cool mind, you will be able to answer it very easily. Now, self-etch and conventional bonding system. You know, self-etch means etchant and adhesive combined. Conventional etchant and adhesive is separate. Simple. So ये फर्स्ट डिस्टिंग्विशिंग फीचर हो गया. लुकिंग एट द ऑप्शंस. ऑप्शन 4, कन्वेंशनल बॉन्डिंग सिस्टम यूटिलाइज स्ट्रॉन्गर एसिड एजेंट, potentially leading to greater enamel demineralization and reducing long-term bond durability compared to self-etch system. Now self-etch system is if I remember correctly, it's a generation 4 or 5th, and self-etch is generation 4th and 5th, and 4 or 5, and conventional is generation 3. Now generations evolved so as to reduce the number of steps and increasing the bond step. So option 4 is eliminated just by common sense. Option 3, self achieves greater bonding strength due to chemical bonding between the adhesive and the tooth structure, enhancing the retention of orthodontic brackets. Correct, great bonding strength होती है, बिल्कुल ठीक है. Due to chemical bonding between adhesive and tooth structure, no. Now there is chemical bonding, but this is not the distinguishing feature between the two of them. Conventional also achieves by the similar method only. Option 3 is eliminated. Option 2, conventional achieves higher bonding strength than self-etch. First statement में option 2 is eliminated. That leaves with option 1 only. So by reading the question with a cool mind, I was able to narrow down and eliminate options and solve. So that is the another trick for you to solve. Next question, in Ricketts word index, which of the following is not included? Now this type of question is a kind of a bouncer for everyone, because this word index we study during our post graduation. It's not generally, I haven't taught to my students in my class the Ricketts word index post this, prior to this question when it came in 2024. So if you are knowing about this index very well, if you don't know, you can very well skip, because this is a bouncer for everyone of, and exam में थोड़े बहुत एक तो ऐसे bouncer होते ही है, so as to level the playing field for all everyone. So if you waste your time over this type of question, then आपको जो आते हैं question थे like class 2 div 2 का feature, that was a very easy question. Facial angle, image base, certain growth parameters and all that, they are very easy. So you won't be able to attempt those questions. Okay, so not included. So it's the lower facial height. So what is vert index? It's a vertical facial pattern index. Okay, so it was developed to classify faces into 3 types: dolichofacial, brachyfacial and mesofacial. 5 key measurement tools are facial axis, facial depth, mandibular plane, anterior-inferior facial height and mandibular arch, to classify them into these facial. Okay, so lower facial height is not part of this index. So for you to remember, you have to remember that these are the 5 parameters which are used in this. And what is the vert index, and in what basis you know the facial patterns: dolichofacial, brachyfacial and mesofacial. Formula for classifying and their values, this also should be known to you. Next question, which approach aligns with contemporary orthodontic treatment concepts? Orthodontic correction utilizes extraction of preferred teeth to manage crowding. Orthodontic correction can often be done without any tooth extraction within soft tissue limitation. Every correction avoids extraction regardless of the clinical scenario. Orthodontic correction always involves extraction to achieve optimal results. Now, even if you don't know the options, what is the question, you can very well eliminate option 3 and 4, because you know from your graduation, from your OPD, you would have seen people doing some cases with extraction, some cases non-extraction. So avoids extraction or always involves extraction is not part of orthodontic treatment. Cases can be treated extraction, non-extraction as well. Option 3 and 4 are eliminated. That leaves you with option 1 and 2, and as I've told, if you are able to narrow it down to 2, you can very well should attempt this. Now coming to the question, contemporary. Contemporary means newer approach. So as we have discussed, in the earlier approach was extraction. Now the newer approach is about soft tissue balance. Earlier approach was hard tissue. You had to look at the hard tissue, that is cephalometric values and model analysis, and based on that you have to plan your case. So if the cephalometric value says the incisors are proclined, you have to go for extraction. Now the newer approach is to look at the soft tissue balance, and based on that you have to take your call whether to go for extraction or non-extraction. You don't have to solely rely upon cephalometrics and model analysis. So it can often be done without any tooth extraction within soft tissue limitation. A similar kind of question, that is the Profit Ackermann classification. Came in your May 2025 exam. That is, importance is given now to the soft tissue analysis over hard tissue. So this is option 2 is correct. I'm sorry I didn't wait for you guys to answer for this. Okay, so this concludes our session for May 2024. Any doubts? I have written up over some points for you guys to go through if you are not able to remember that points, because there are the questions which further leading questions which can be formed. And as I've told you, right now you have to look up at MCQs with the thought process that 1 correct, 3 incorrect, 3 incorrect can form 3 different questions. Solve now, just 1 month remaining. Solve full course test. So PYQs from last 10 years starting with the latest should be thorough with you. If you are able to find it, very well. If you're not able to find it, do not panic कि हमें नहीं मिले, बेसिक और को मिल गए. ओके, जितना है उतना कंप्लीट करिए. उतने में अगर आप गलती करेंगे देन दैट विल बी अ ब्लंडर फॉर यू. Okay, so I hope the session was informative for you. If any one of you has any doubts, you can very well message me right in the comment section, or you can very well message me as well. I'll be happy to answer. Why soft tissue first? Because the latest or the newer protocol says that you have to balance. The aim of the orthodontic therapy is not just to align the teeth, is to correct the smile as well. Okay, and the smile will be correct if the soft tissues are in balance. That is, the lip relation, the cheek and all that are also in balance. Okay, so just looking at the case as a crowded case and all that, okay, and extracting it, okay, can lead to retruded profile, and the balance of the soft tissue will be disturbed. Okay, so all the concept of retention and all that, the soft tissue balance, the fourth component of orthodontics, that is the muscles, should be in balance. Okay, so the fourth component, another question, is muscles. Fifth is time. So soft tissue and muscles, if the muscles are all in balance, the teeth on the dental arches will be balanced and it won't lead to relapse of them. Okay, now clear? Graeber gave the concept of 3M. Later on, the fourth component, that is muscles, was added by Brody. Okay, so I think I can end the session. No more doubts. So thank you for joining. Next time we'll meet with the November 2024 and then May 2025. Any doubts, please ask. Anything beyond that, you can very well call the DAMS team and they will be able to help you out. Time is lastly seen. Yes, time is the fifth component. Basically age. Okay, so I'll end the session.